In the last 9 years, 1 million people in the corridor have gotten professional medical advice from a registered nurse over the phone for free. Mercy Hospital On Call in Iowa City celebrated its 1 millionth call today. And CBS 2 News reporter Brittany Borghi is here to tell us why the program has been so successful. You okay there, Brittany?
Yeah, Tiffany, you know, I'm feeling okay, but let's imagine that you woke up one day for work and you weren't feeling okay. You didn't know if you should go to the job or go to the doctor. You wished that there was just like a nurse that you could call on the phone to see if you should do one of those things. Well, luckily, there is, and Mercy's on-call program is just one of those kinds of services. They say providing free medical advice to people over the phone is just part of being a good neighbor.
Mercy On Call, this is Sue. How can I help you?
Registered nurse Sue Kuntz answers her phone in the Mercy On-Call department, and it happens to be a patient she talked to yesterday. The patient went to the doctor, but still felt sick.
So what did they tell you yesterday then? Did they do anything different, or they find anything different?
Sue takes down notes on the patient's record to create a mental sketch of how he feels.
And if I asked you to rate your pain for me, 0 to 10.
And whether or not he needs to see a doctor again.
We try to do what we can, because not everybody needs to see a doctor or needs to come to the emergency room, and giving them just care advice, anything, even sometimes just reassurance.
That can go a long way, especially when visits to emergency rooms have increased dramatically since 1996, according to the Centers for Disease Control. The on-call service can cut down on those visits. One of their missions is to hook up callers with a primary care physician.
So that way, in the future, when they are sick, then they will have somebody that they can go to, and then they won't necessarily need to come to emergency room for just little simple things.
It means a lot to nurses like Sue, whose patient isn't getting any better. Sue makes sure he can get into the hospital today.
Well, I think you need to come back in and have him recheck you.
Lucky for him, Sue was just a call away. Mercy's on-call nurses have nearly 300 hours of experience between them, a necessary thing for the people who are on the phone or maybe stuck, sick, and still in bed. Covering the corridor from this lovely mattress and bed. Brittany Borghi, CBS 2 News.
We're glad you're really okay. Thanks so much, Brittany.